Ladies and gentlemen, you welcome back on our episode of Health is Wealth, and your health is our concern. As usual, or on the other previous topic, we are looking into the renal system. And as I told you before, that renal system consists of the kidneys, the ureters, the bladder, urinary bladder, and the urethra. But we looked previously into the kidneys, and I hope now you're ready to explain what the kidneys are and how many are they, and some of the complications that affect the kidneys, as I told you, and what are the signs and symptoms when you have, and how to manage and how to see the doctor. Now today specifically I want us to look at the ureters and the urinary bladder and the urethra. These systems, they help us in the excretory system, that after the urine is being formed from the kidney, is being stored in the urinary bladder. But it is transported through the ureters. Those are the pipes that joins the kidney and the bladder. And now from the bladder to be excreted out, we use what we call the urethras. But also this bladder, the urinary bladder, we call it as the sac, which stores the urine. And when it is being filled up, that's when it is excreted out. That's when you find that a person can take a lot of fluid. You take your tea, you take your porridge, you take water, you take other fluid, juice, what and what. And then by the process as it's being filtered or excreted from the kidney, it's all being stored. And when the bladder is full, that's when it is excreted out. So what is the function of the bladder? The function of the bladder is to store the excreted urine from the kidney, or all the fluid that is being excreted through the kidney, then it's being stored there. And what is the function of the ureter? Is to transport the excreted fluid or the urine from the kidney to the bladder. And the function of the urethra is to excrete the urine or the stored urine from the bladder out of the body. So we have also problems or the disease that affect the bladder, the urinary bladder. One, we have what we call the cystitis, or the inflammation of the bladder. That inflammation comes in due to a lot of things. One, if we get accidents, or like when you get accident and then you get a lot of force into this lower abdominal, down the stomach and between upper the pelvic here, because the urinary bladder mostly sits on the pelvic region. So in between there, if you get an accident or an emergency that damages the pelvic region, you might end up getting cystitis or the inflammation there. Two, we have the infection, mostly like the urinary tract infections, such as the candidiasis, the trichomoniasis vaginalis, the one which we talked about before. All those might affect the urinary system. Also, we have other problems like the urinary incompetence, whereby the bladder can no longer support urine, whereby it comes and then it just comes out, it goes out, it goes out, it goes out. We have cancer, we have prostatitis, which regulates the hormones which supports the bladder to hold the urine for a long time. So all those things. So if we get those problems, the bladder will not be able to perform also its function of storing the urine. And how can we know that our urinary bladder or the ureters are affected? One, we get what we call the abdominal pain, mostly in the lower region. When you tend to get the lower abdominal region, in most cases that pain comes from the bladder inside. So that's one of the symptoms that can tell you that you have a problem with your bladder, or there is a problem in your renal system. 2, we have the pain in the ureters, mostly also back in between here, as the kidneys also are being affected, also the ureters. So the pain in between there also. We have what we call painful micturations. When you're feeling pain while urinating. So that pain comes in when you have like those infections, wounds inside there also. We have also when we have resistance in urinating, like when you get those infections and then you try to urinate and then you fail. So those are the some of the symptoms and some people get on and offset of fever. You feel some body weaknesses, all those, but those are just symptoms outside. But internally, you can get that. Also, if also your bladder is having problems or it has been damaged internally, you can have also that the urine contains some blood cells in it. Also, when you urinate and then you see blood in urine, automatically you suspect that either one of your organs in the renal system is having a problem, be it a bladder or be it a kidney. And how can you detect that? From signs and symptoms, you can also do some tests. Mostly the most test that is being done is the scan with the urinary system or with the urinary bladder. So if you tend to get such complications or symptoms, I advise people you go you see doctor and also you do the scan as a must. And also you can do the laboratory test of urinalysis and also they detect. And in most cases also we can do a biopsy by putting through other systems, or to some people we can also do a catheterization and then we get the internal contents of fluids from the bladder itself without the passage through the urethral systems. So with that, I hope you can be ready to explain the symptoms. And how can it be managed? We can manage it by doing some surgical procedures, surgical repairs. We can do, if you have some urinary inconsistency by when you cannot urinate due to a blockage in the urethral systems or what, we can do catheterization. This is a process whereby we introduce a tube through the urethra up to the bladder to drain that urine out if you cannot. Or if not that, when there is some blockages and inflammation through the urethra, we do what we call the suprapubis process or the procedure, whereby we get a catheter or a thermothane catheter or a syringe and we come under this abdominal region. We pierce and then we start draining the urine. Or we can do a drainage system. We put the catheter through your abdominal region into the bladder. That is a surgery, a minor surgery, and then we take the blood, the urine out of the bladder. So with that, it's a simple way of draining urine from the bladder and also treatment. So how can it be managed? As I've told you, with that management, also we have what we call clinical management, whereby you get the antibiotics, you get the treatment concerned according to the causative problem, or either the UTI, accident management or repair or anything. But also we should put in mind that some problems that come to the urinary system, they can come as a result of postoperative surgeries or some surgeries that might come through that accidental damages. So in most cases, if you have had any surgery, like for mothers who have been undergone the cesarean section, that we advise you also to do a scan after a post-surgery to see that all the organs are intact and in normal to avoid problems. Thank you very much, and I believe you can explain and you can talk about the system of the renal system under the ureter, urethra, and the urinary bladder. Thank you very much.